of women between the ages of 20 to 40. Most people have it. They've never heard of it, though, and it's called Vestibulodynia. The condition makes sex extremely painful, even impossible for some women. Dr. Alyse Jones joining us this morning. So I got the name of the condition right, but I got your name wrong.
That's okay.
Vestibulodynia. What exactly? Thanks for being here, by the way.
Thank you. You're welcome.
We've been kind of joking about there should be an acronym for it because it's so difficult to say, but it's a really serious condition, and a third of women, really?
Right, and not only is it a hard thing to say, it seems to be a hard thing to diagnose, but I really think it's a very simple thing to diagnose. Women, there's two types. Women are either born with it or they acquire it. Women who are born with it are never able to use a tampon without having pain. They are never able to have pain-free sex. Oftentimes, this is a woman who's been in a marriage for a while and has never been ever able to have pain-free sex.
Wow.
So it's disappointing on many fronts. Number one, she doesn't know that there's anything wrong with her. Number two, she's emotionally kind of a wreck because this is something she's been wanting to have, and she thinks she's broken because she can't do this.
And so it's not, there's often the joke out there, I have a headache, or there are excuses that women
Right.
may make in relationships. But this is real, and you brought up a really good point. It's emotional. I bet not only for the wife, but maybe even a husband in this case, for not being able to make it comfortable for his wife.
Right, and so he thinks that maybe she doesn't love him, or maybe
Not
she's really not into him. And so but what women need to hear is that it's a real disorder. If you have pain with sex, go see your doctor. The only problem with that is the average woman who has this condition sees 7 practitioners before she gets a diagnosis.
Why is it so hard to diagnose?
It's really not hard to diagnose, but oftentimes we think it's a yeast infection, we think it's a skin condition, and it's really not a skin condition. It's a nerve condition. Women will feel a burning sensation in this area of the vulva that doesn't ever seem to go away, and they only feel it when they're touched in that area. So it's really simple for a doctor to make the diagnosis. They just have to sometimes get to the right practitioner. And then treatments, we don't really know what causes it, except we know it's a nerve problem. And then treatments can be difficult because it's not well studied. And so sometimes that's surgery, sometimes that's putting some numbing cream on the area to get the nerves to kind of chill out. But women can get treatment and actually can be cured of the condition.
I'm so surprised, though, that it's such a young age range, 20 to 40 years old.
Yes, so the women that are born with it, obviously when they start having sex in their 20s, that's when they get to figure out, oh, I have this problem. And then as we age, hormonal problems can cause it. Being on long-term birth control pills can cause it. So if you think about somebody who's been on birth control since she's been 20, starts to develop this condition in her 40s, she's like, I don't know, nothing's changed. I've been doing the same thing the whole time. But oftentimes birth control pills can actually cause this condition.
So really ask your doctor perhaps for this particular testing so that you don't have to go through practitioner after or come see you.
Yeah, there's a great book out there called When Sex Hurts by Andrew Goldstein, and it's awesome. And if anybody thinks they might have this, I encourage them to get that book, read it. You'll read about yourself in the book, and then seek out a practitioner that can treat this.
Dr. Alyse Jones, thank you so much.
You're welcome.
You've been shedding light on something that's really important and really good for women to hear, and men too, that this is a real condition.
Right.
All right, so don't